Puerperium is a period after childbirth where the body organs go back to the pre-pregnant state. So it is normally 6 weeks after childbirth. It is divided into immediate, which is the first 24 hours, then early, which is the first week, and thereafter up until 6 weeks, it is called as late puerperium. So what are the general physiological changes that are seen during puerperium? The pulse goes back to normal. The pulse, everything is basically going back to normal here. So the pulse initially after delivery, it will be a little high, but after some time it will go back to normal. So on the day of delivery only, after a few hours, it just goes back to normal, and perfectly, and by second day it is like totally normal. But sometimes there can be rise in pulse rate with any pain, scar tenderness, etc. Then temperature. So again, within the first 24 hours, temperature will be a little high in normal pregnancy following delivery and all. They might have chills also, which is again absolutely normal. It is not indicative of any infection as such. There may be slight reactionary rise following delivery. So there is rise by 0.5 degree Fahrenheit, and it will go back to normal by 12 hours. If temperature is present on the second or third day, along with any scar tenderness, breast tenderness or pus, then it is indicative of infection usually, and mainly it will be genitourinary infection. Or next common is breast. Then you are coming to urinary tract. So in the urinary tract, the bladder mucosa is edematous and hyperemic and has submucosal extravasation of blood. Bladder capacity increases. The bladder will become over-distended, and common urinary problems are over-distended bladder, incomplete emptying, and presence of residual urine. Now, whenever there is residual urine, there is increased chances of infection. So, risk of UTI is very, very high. And the renal pelvis, renal ureters that are dilated during pregnancy, they will go back to normal within 8 weeks. So we collect a clean cat sample and then we run tests to rule out any infections. Now coming to GI tract. So from the labor itself, woman has to consume a lot of water like during the period of labor, because there are high chances of dehydration. So there is basically increased thirst in the puerperium because she has lost so much fluid during the process of labor. And then she's also losing fluid in lochia because of diuresis, perspiration and all. And the other problem is constipation. So increased thirst and constipation. Intestinal motility is a little delayed. Mild ileus may be seen following delivery together with the perineal discomfort. And some women also experience anal incontinence. Now next, coming to weight loss. So that's why after delivery we usually start like a solid diet from day 3 onwards, and then day 1 operative only post-op we check for bowel sounds. So we should have presence of bowel sounds. There should be passage of flatus. Now weight loss. So immediately after pregnancy there will be around 6 kgs of weight loss, because we know that in pregnancy totally there is 12 kgs weight gain. Out of that 6 is because of baby, and the next 6 is mother. So like the other 6, which is baby plus placenta, all membranes, fluids, etc. So usually around 5 to 6 kg of weight is lost. Then urinary tract and renal function, there is in pregnancy there is diuresis because everything is diluted, but here now it is taking time, and there is residual over-distended uterus, over-distended bladder. It goes, so that initially there is like it will go back to normal by 8 weeks, this dilated renal ureter and pelvis. Now coming to fluid loss. So normally in labor at least a minimum of 2 liters of fluid is lost, so that's why there will be increased thirst in the woman, there will be dehydration. Now the loss of salt and water are larger in a women with preeclampsia and eclampsia. Now coming to blood values. So blood volume will decrease immediately after pregnancy because of loss of blood, loss of water. So all these features lead to loss of blood volume. But cardiac output immediately after delivery, it is the maximum in the immediate postpartum period. It is going back to normal by 1 week. Then RBC levels, everything in puerperium, ultimately we should remember everything is going back to normal. So this then goes back to normal by 8 weeks almost. So initially there'll be leukocytosis, immediate postpartum period because of the risk, because of the stress of pregnancy. Then platelet will also decrease again after the shedding of placenta, because it is used for all clot formation to control all this bleeding. Then the fibrinogen level is high up until the second week of puerperium. So basically there is a hypercoagulable state in the next 48 hours. It is preventing any bleeding. This is body's natural mechanism to prevent postpartum hemorrhage. And by 4 days, uh, so hypercoagulable state is there for 48 hours. Then the fibrinolytic system gets activated by 4th day, and then all the factors are normal. So then menstrual function. If a woman does not breastfeed her baby, menstruation comes back by 12th week. But if she is breastfeeding, then you'll have lactational amenorrhea for around 6 months. So what is lactational amenorrhea? There is increase in prolactin to facilitate lactation. This prolactin has a negative feedback on gonadotropins, that is FSH, and as a result of that, estrogen, progesterone are not released, and hence there will be no menstruation. So usually it takes around 6 months, so it offers protection of at least 6 months duration.